Hello and welcome back to TCTV On Location. We're at Maumee Bay Pediatrics in Oregon, and I'm here with certified nurse practitioner Carrie Baker. She works in pediatrics here. Can you talk a little bit about why you love working with the patients here?
I just love pediatrics in general. I've been a pediatric nurse for close to maybe 27 years. Been a pediatric nurse practitioner for close to 15 years. I actually just love pediatrics in general. Love working with them. They're authentic, they're honest, and they're easy to treat.
And you work a lot with families, so that means educating the parents about some different things when kids come in complaining of feeling sick, and educating parents on, well, it might not be a case where we need to give your child an antibiotic. Can you explain that a little bit?
Yeah, we only tend to use antibiotics for bacterial infections. So really you only have three sources of an infection when a child comes in, whether you're looking at it being an allergic, a viral, or an antibiotic or a bacterial infection. And viral infections, you really just have to run their course. So it's really taking care of symptomatic treatment, and every parent just wants their child to feel better. And it's not appropriate really to give antibiotics for viral infections, because it's not going to make them better, but it is going to build resistance to the antibiotics. So if and when they ever need those antibiotics, the antibiotics are not going to be effective. So, I think that the key is to just educating parents, on good symptomatic control, educating the difference between bacterial and viral infections, and helping them to understand how to help their child feel better, and educate them as to what to expect and how long it's going to take.
And what are some of the common bacterial infections that you would maybe test for and treat?
The top three bacterial infections that we would treat are going to be strep throat, which is going to be only actually streptococcal group A beta hemolytic. We have tons of strep infections, but that tends to be the only one that we treat. And we treat that actually from the complications from strep, that in a significant amount of those patients, they will actually develop rheumatic heart disease. So strep would be one, a urinary tract infection would be another, and then in your older teenagers, STDs. But really, those are the only three major bacterial infections that require an antibiotic.
And talking a little bit about prevention, trying to keep kids healthy. Kids are young, they're sick, they get sick, they're building their immune system. That's not uncommon, but there's ways to maybe prevent and protect your children with some of the vaccines, right?
Absolutely. Vaccinations have done a wonderful job statistically, and I'll be honest, I have not memorized the stats, but on the CDC website, the immunizations have a very high rate at preventing the very common communicable diseases that actually, once they start to resurface, you start to see a widespread infection in that community. Just even the recent outbreak of MMR, where you're starting to see more and more cases across the country. So it is easily spread, it's highly communicable. So when you vaccinate, you build up immunity to those illnesses that can be life-threatening and devastating. So immunizations is the key to most of our bacterial infections, especially bacterial infections that cause ear infections, actually.
And if a parent is just not sure and their child's sick, what's your recommendation? When they're like, oh, do I bring them in? Do I not bring them in? What would you tell a parent?
I think it's always appropriate to bring a child in. I mean, I think that that's probably 90% of my job is to educate, give parents reassurance, and help them to understand what's going on. So bringing a child in and walking out and not getting an antibiotic, but getting education, I think is more powerful than actually even getting the antibiotic in the first place. So I always encourage patients and parents that if you don't understand and you just want simple reassurance, to come in. I think that that's what we're here for.
Well, thank you so much, Carrie. That's all the time we have for right now, but we'll be back with more.